The Civil Society Legislative Advocacy Center, CISLAC, in collaboration with the Tax Justice Network Africa and the University of Cape Town, has called for stronger tobacco excise tax policies to protect public health and increase government revenue. This was disclosed at the opening ceremony of the validation workshop on the tobacco excise tax simulation report held in Abuja. Our correspondent reports.
The need to stimulate tobacco tax reform stems from rising health risks and the economic burden of tobacco use in Nigeria. Experts argue that current excise tax levels fall short of regional standards, making tobacco products more affordable and increasing their consumption. To address this, the University of Cape Town developed the tobacco excise tax stimulation model, which integrates Nigeria-specific data to project the impact of different tax rates on both consumption and government revenue. The director of CISLAC, Awal Ibrahim, noted that tobacco products cause significant damage to the health system, urging government action to ensure Nigeria does not become a dumping ground for harmful products.
We are hoping that government will do more to ensure that we discourage Nigerians from taking these harmful products. Simply put, when tax rates are too minimal, the industry with an already higher margin of profit can easily absorb the burden without shifting the final consumers. When this happens, tobacco products will remain very cheap, easily accessible to even children, and prevalence of tobacco use will remain high. We need to support government to ensure that government achieve its objectives in terms of its effort to drive revenue for the benefit of the Nigerian people.
According to stakeholders, the stimulation report will provide policymakers with evidence-based guidance to design a stronger tax regime capable of reducing affordability, improving public health outcomes, and boosting revenue mobilization.
We at the University of Cape Town, we've developed a model called the Tobacco Excise Tax Simulation Model. This is a model that basically provides support to countries to see or to quantify what the likely effect is of increasing the excise tax. At this point in time, the Ministry of Finance in Nigeria is rethinking its tobacco tax policy. It's a very opportune time. Our hope is that this study, which tries to quantify the public health and the fiscal impacts of an increase in the excise tax, is going to support the relative parties in Nigeria in order to increase the excise taxes very dramatically over the coming year.
Our focus is not only on strengthening revenue generation, but also on protecting public health in line with the global and regional commitments. This effort is consistent with the ECOWAS directive on excise duty, which encourages member states to implement harmonized and effective excise regime.
And therefore we will have a healthy society, a healthy public, and the money or the funds that they were using in terms of buying tobacco products, consuming, and losing in terms of their health, they will be able to invest in other quarters. So this means that if you have, for instance, 1,000 naira, instead of buying tobacco products, you will be able to consume other products still within the Nigerian space.
The workshop was part of ongoing advocacy efforts to establish a tobacco excise tax regime that safeguards public health while supporting national developments.